you've met your insurance deductible. Think about this. So when you go in for a medical test, you really don't expect to pay much or anything at all. But when you go to your appointment, you're told you owe a lot. Don't pay, and you don't get your tests. That is exactly what a Valley woman faced. And all new for you this morning, the Let Joe Know team is learning that she's not alone.
When she showed up for a diagnostic procedure, Ina thought she'd pay just a few dollars, that her insurance would cover the rest. Instead, she's told to come up with $150.
I was shocked because I knew I'd met my deductible. I knew it shouldn't be that much.
Her choice, pay out of pocket up front now or cancel the appointment.
I didn't want to delay any diagnoses or treatments.
So she paid, later learning from her insurance explanation of benefits, she was right. She paid too much.
I should have paid $8.96. So I immediately called SimonMed and asked them for a refund.
With more than 24 locations in the Valley, SimonMed is a popular choice, and they've been plagued with billing complaints. Since our first reports aired, dozens of SimonMed patients came to us saying they too were shocked by what they had to pay up front in order to get their procedures.
When I went there, they told me I had to pay cash.
They said, no, it's $175 cash. And if you don't pay it, then I guess you can just reschedule it.
These women shared similar stories, some forced to pay more than expected, then having to struggle to get a refund for overpayment.
I did everything. I called, I went in person, I emailed.
And they kept saying the check's in the mail.
When Ina complained, she says she was told SimonMed would start an investigation, so she waited.
About 30 days and still hadn't heard anything.
She filed a complaint with the Better Business Bureau, which has an alert involving SimonMed. The BBB says there's a pattern of consumer complaints about the company not responding to billing and refund inquiries. One of the big questions from patients, why all the charges when SimonMed should have their insurance information and know how much they should pay up front? In a statement, the company writes, in part, SimonMed provides patients with price transparency based on estimates before their appointment. Estimates are based on the information provided by the patient, referring physician, the insurance provider, and a national healthcare claim processing agency. Ina did not give up.
I will call you every day until I get my refund. And that's what I did.
5 months later, she got more than $140 back and plans to use a different imaging company in the future.
If you have to go through this kind of hassle, the convenience up front is not worth the inconvenience later.
The full statement's online at abc15.com/letjoeknow, as well as tips for consumers before an appointment to avoid a financial surprise and ways to file a complaint if you think there's been a mistake. I'm investigator Joe Ducey. If you got a problem, let me know.